Relaxing the shoulders. Oh yeah, that is crunchy.
Huh? Oh, I like that one. That one's my favorite.
That's awesome. In terms of where you're feeling it the most right now, where do you feel it at today?
That's a good question. Yeah, I mean, I'm just super aware of this area
The lower
all
back.
the time, and my sciatic and whatever it's affecting down there.
Okay.
Over the weekend, it was hurting.
Okay.
But I feel a ton, like my demon is angry right in here.
Right in this area.
Yeah.
Okay. And then you can have a seat. Right here.
Sure.
Yeah, seat. Okay, so you're feeling it more so like it's more so onto the right side, or is it kind of going both sides?
It's both, but the right is usually a little
Where you
more.
feel it the most.
Yeah.
Okay. And so you're feeling it here. Does it come from the top and then radiate down, or do you just feel like this is like just in that area?
Yeah, it radiates.
So you
It's
do
the
feel
whole
it
thing.
radiating. Okay.
Yeah, because I get like stuck right here sometimes, like caught up on itself, and I have to work it out, and it snaps.
Okay, gotcha. So you definitely have some swelling going on here. Now, one thing that we do notice here is that when you do get a lot of chronic stress in this area, you will start to get these little tiny like spider veins that kind of pop out just because there's so much stress on here. So that is pretty evident here. And then with this, obviously, that can translate to some of the stress into this area. Now, with your neck on the x-rays, you do have this spot right up here that's pretty degenerative. So we're going to take a look at that, but we're going to see if we're going to work on this or somewhere down below once I get you scanned again. And then the lower back, you're saying it's right onto this side over here. That's where you're feeling it in this area.
Mm-hmm.
Okay. A lot of these stresses that we accumulate, it's just repetitive stress, and unfortunately technology doesn't help. A lot of times we're on our cell phones.
Yep.
And our heads looking down for long periods of time. So right, that's where it's at right there.
I'm very cognizant of how much I'm looking down.
Really? So you're kind of aware already?
Oh, I'm hyper aware of how I'm holding my body.
Mm-hmm.
Especially when I'm on those damn phones and on the computer.
Yeah.
Because there's no escape.
Yeah, there's no escape. And so all we can do is try to teach people a new way of using technology, whether it be improving your ergonomics with your laptop and your computers, or even with your cell phone, just kind of bringing the cell phone up, not bringing your head down. It's a big difference.
Yep.
Any pain or soreness, where do you feel it at the most? 5, 6, 7.
Ooh, 6 and 7 feel pretty mad.
Mm-hmm.
More upset than the 5, actually.
Yeah, that's what I was going to tell you, because even though 5 looks really bad on the x-ray, it looks like 6 is where it does not want to budge there.
Yeah, it doesn't feel good.
So there's two things, right? Because we talked about how the degeneration can occur because of the lack of movement, and as that joint's shifting forward or your head's shifting forward, it compresses the joint. Another reason why that joint can become degenerative is because the joint down below, it gets stuck. So the joint above it overcompensates and it moves too much, and over the years it will start to wear out. So that might be what's going on here, is that your C6 right there does not want to move. And because of that, your 5 has gotten really worn out there. 6, 7, 1, 2, 3. Here's 4, 5, 6, 5, 4.
Oh.
Which is the worst?
4.
4. Okay. Yeah. So that's that one that curves going on over there. Okay. And then right down below here, 5. Here is L5, 1, 5, 1. Any pain on those ones?
Maybe 5.
Maybe 5. I want to go a little bit to the hip over here. Here's the upper joint here. Middle. Upper. Middle. And then lower down below. Seems like this middle joint seems to be a little bit more inflamed there.
Feels more tight or something. It's not really pain. It's more like, yeah. Oh, I feel something there.
Right there,
Yeah.
that's your sacrum right there. Yeah, I can tell your sacrum doesn't move, so you actually have a little bit of posteriority on that right sacrum. So those two joints connect here from that right ilium and then the sacrum here. So when that joint kind of pops out a little bit, it will inflame that area that you're talking about. So I think we're going to work on your sacrum today. You're going to do your T4, and then we're going to work on your C6 and see how your body does from there, okay?
Great.
All right. So from here, all you got to do is relax that shoulder. I'm going to give it a little bit of push. There you go. Chin up a little bit. That's what I'm looking for. Okay.
Interesting. I've never been belted in like that.
Never before.
No.
Yeah, well, the good thing about the seatbelt is it makes the adjustment a lot easier for the patient, but really it also makes it easier for me because I don't have to put as much force or as much speed just because you're already secured.
Yeah.
And once I get that joint to move and right where it needs to be, I just get a little bit of a push and that's where it needs to happen. Relaxing your shoulder. A little bit of a push. There you go. A little piece. One more here. There you are. There's the rest. Okay. So how are you feeling right now? Any difference? What are you feeling? Any goodness?
I
soreness?
almost feel like this side got like raised a little bit.
Yeah, well,
something.
When we're adjusting that sacrum, it definitely is shifting that. And you can tell how your left hip's a little bit shorter on that left side. So as we start moving the sacrum, you will start to notice like it feels like a little bit of a difference. Your body's starting to balance out
Just a little. I feel it a little bit over here.
All right, so we already got your C6. We're gonna go down to your T4, and this is where that spine kind of kinks over to that side here.
Oh,
1,
man.
2, 3, and then 4. Right there. Relaxing the shoulders. Oh yeah, that is crunchy. Huh?
Oh, I like that one. That one's my favorite.
That's awesome.
Sometimes I'm like, how do I move myself around to try to almost get it to do it itself. And
Yeah.
I get a few little pops. I get massages fairly regularly too. I kind of have to.
Yeah.
Or I'm screwed, you know?
Yeah, well, it's hard because even myself, come on down. As a chiropractor, you know, there's definitely times where I'm like, oh, I gotta try to, you're gonna have a seat.
Sure.
I try to get that spot where it's like, oh, it's just right in the middle of the back, but you can never get it, you know? And it does require a specific adjustment to really correct it the way it needs to be. And so, yeah, so as much as we try to get that neck to move, as much as we try to get the mid back, yeah, that's much better actually. That's a really good, I'm really happy with how that's responding here. Now that we got movement into the joints, walking continues that process to continue to happen. Almost it's like when we have like a key and just unlocks the spine. Now all the years of compensating and stress that we've been developing over the years, it's undoing. And so walking is going to allow that process to happen. Now with that, you can see things start to shift and move and change, and that's okay. It's actually a good thing if that happens, because your neck, it's been this way for so long that when we start to move that, things might start to shift upwards, it might shift downwards. But as you continue through the process over time, that should start to undo and relieve some of that stress that we're experiencing, okay? So ice, if you need to, will be your best friend right now. So 15 to 20 minutes. If you feel any soreness, any tenderness, achiness, ice 15 to 20 minutes, okay? For every couple of hours if you have to, okay? But if you're feeling good, things are doing okay, don't worry about it. But ice is a good helper when it comes to reducing inflammation.
Right.
Okay? So ice and walking, those are the only two things I need to worry about right now. Okay. Other than that, any questions for me?
Not walking in the pool.
Oh, even better.
Even better.
Yeah.
Because it takes the
It takes off the
impact
weight.
off.
Yeah. Come on over. I want to show you what we did today. So the three things we did today. We did your C6. Again, this is your C5. Although it's worn, that C6 really, that was really stuck in there. We might still go up to C5 later, but that C6 is where we're going to focus today. Then we'll kind of check in on C5 next time, okay? The other one that we did was going to be your tailbone, and that's going to be your sacrum. Remember I told you that's kind of scooped down below?
Mm-hmm.
We're going to try to scoop that underneath that, so then that way, that will start to reduce some of that curvature in that lower back. The last thing that we did was your T4. that's this one right here, how it kind of kinks your spine this way.
Yep.
So we're trying to straighten that up to kind of get that to center up a little bit. So we got some work ahead of us, but that joint, as we get that to stabilize, that's where we're going to start feeling a lot more relief from that neck and the shoulders, even with that pelvis and the lower back as well, okay? But other than that, you did good for your first adjustments. Welcome to the practice.
Oh, thank you.
Yeah,
Thank you.
I'm so glad that you're here.
Me too.
Thank you for being here, and then we will see you then next time, okay?